If you have noticed a fishy or unusual vaginal smell, a change in discharge, or symptoms that keep coming back no matter how clean you are not alone, and you have not done anything wrong. Bacterial vaginosis is one of the most common causes of unusual vaginal discharge in women, but it is also one of the most misunderstood because many women assume it must mean an infection you caught through sex, poor hygiene, or something shameful. Most of the time, bacterial vaginosis is not dangerous, but it can be distressing. It can affect confidence and intimacy. And in some situations, especially during pregnancy, it can matter medically. The good news is that bacterial vaginosis is treatable, and understanding it properly can help reduce the chances of it coming back. In this video, we are going to break bacterial vaginosis down clearly: what it is, what it can feel like, how it differs from thrush and sexually transmitted infections, what the NHS typically recommends, when to seek urgent help, and what you can do to protect your vaginal health without falling into harmful myths. Bacterial vaginosis happens when the natural balance of bacteria in the vagina changes. A healthy vagina usually has more of a protective bacteria called lactobacilli. These help keep the vaginal environment slightly acidic, which makes it harder for harmful bacteria to overgrow. In bacterial vaginosis, the protective bacteria drop and other bacteria increase. That shift can change the smell and the discharge. So bacterial vaginosis is best understood as an imbalance. It is not a cleanliness issue, and it is not a judgment on your lifestyle. It can be associated with sexual activity, and sometimes it is triggered by changes like a new partner. But it is not usually classed as a sexually transmitted infection in the same way as chlamydia or gonorrhoea. Now let's talk about symptoms. Bacterial vaginosis can be obvious or it can be subtle. Some women have no symptoms at all. Common symptoms include a fishy vaginal smell, often stronger after sex or during your period. You may notice thin, watery discharge that can look greyish-white. Some women also feel mild irritation or discomfort. Sometimes there is itching, but itching is more common with thrush. Bacterial vaginosis does not usually cause intense soreness, swelling, or thick, clumpy white discharge. Those are more typical of thrush. And bacterial vaginosis does not usually cause significant pelvic pain or fever. If you have those symptoms, that is a red flag for something else. Let's make this simple, because confusion can lead to months of treating the wrong thing. Bacterial vaginosis often looks like a fishy smell plus thin, greyish discharge, and it is often not very itchy. Thrush is more likely to cause itching, soreness, redness, and a thicker white discharge, and it usually does not have a fishy smell. Sexually transmitted infections can cause no symptoms at all, or they can cause changes in discharge, pelvic pain, bleeding after sex, or pain when passing urine. And the only way to know for sure is testing. Here is the key point. You cannot reliably diagnose yourself by smell alone, and repeatedly guessing treatments can keep symptoms going for much longer than they need to. If you are unsure, testing is often the fastest route to clarity. So what triggers bacterial vaginosis? It can be triggered by changes that affect the vaginal environment, including a new sexual partner or changes in sexual activity, douching or using internal washes, strong soaps or scented products, and changes around your period. Sometimes it can also happen around contraception changes. But let's be crystal clear about what it is not caused by. It is not caused by being dirty. It is not caused by not washing enough. In fact, overwashing can make it worse. It is not a moral failing. And it is not a sign that you did something wrong. You deserve medical care, not judgment. For many women, bacterial vaginosis is mainly about symptoms and quality of life. But there are situations where it has medical importance. It can be linked with an increased risk of acquiring some sexually transmitted infections. It can sometimes be associated with pelvic infections after certain procedures. And in pregnancy, it can be linked with complications in some cases. This does not mean you should panic. It means that if you are pregnant, trying to conceive, or having a procedure, it is worth getting symptoms assessed promptly rather than self-treating for months. So when should you get checked? It is reasonable to see a GP or a sexual health clinic if it is your first time with these symptoms, if you are pregnant, if symptoms keep coming back, or if you have pain, bleeding after sex, fever or pelvic pain. It is also worth getting checked if you are not sure whether it is bacterial vaginosis, thrush or a sexually transmitted infection. And if you have pelvic pain, fever, or you feel unwell, do not assume it is just bacterial vaginosis. Bacterial vaginosis itself usually does not cause severe whole-body symptoms. How is bacterial vaginosis diagnosed? It is often diagnosed based on your symptoms and your history, plus a vaginal swab or a vaginal acidity test, depending on the service. Sometimes tests are also done to rule out sexually transmitted infections if needed. Sexual health clinics can often test quickly and confidentially. GP practices can also diagnose and treat bacterial vaginosis, especially when symptoms are straightforward. The goal is simple: confirm what it is so you get the right treatment instead of treating the wrong thing again and again. Now, let's talk about treatment. Bacterial vaginosis is usually treated with antibiotics. NHS treatment often includes metronidazole, either as tablets or gel, or clindamycin cream, depending on your situation and local guidance. Take the treatment exactly as prescribed and finish the course. And if symptoms return, that does not mean you did something wrong. Bacterial vaginosis can recur. When that happens, the goal becomes two things: treat the current episode and reduce triggers that may be disturbing your vaginal balance. If bacterial vaginosis keeps coming back, here are practical things to consider. Are you using scented soaps, bubble baths, deodorized products, or internal washes? Stop those. Are you douching? Avoid it completely. Are you using harsh detergents on underwear? Switch to gentle, fragrance-free options. Do symptoms seem linked to sex or to condoms? That is worth discussing with a clinician. Have you been repeatedly using thrush treatments without testing? That can delay the right diagnosis and the right treatment. It is also reasonable to ask your GP or clinic direct questions like these. Can we confirm it is bacterial vaginosis each time and rule out thrush and sexually transmitted infections if appropriate? This keeps recurring. Can we talk about a plan, not just another prescription? Do I need a different treatment or a longer course if this is recurrent? Is there a maintenance plan for recurrent bacterial vaginosis? You deserve a strategy, not just repeat cycles. Now, a quick word about internet remedies, because this is where things can get confusing. Some women report improvement with certain probiotics, but the evidence varies and products differ widely. If you choose to try a probiotic, think of it as an add-on, not a replacement for antibiotics when bacterial vaginosis is confirmed and symptoms are significant, especially in pregnancy. You may also hear about boric acid online. It is sometimes discussed for vaginal symptoms, but it is not appropriate for everyone, and it must be used with caution. Do not insert anything internally without proper medical guidance, especially if you are pregnant, trying to conceive, or you have unexplained bleeding. And please remember this: you do not need to detox your vagina. The vagina is self-cleaning. The goal is to protect the natural balance, not attack it. If you want to be taken seriously and avoid repeat cycles, here are a few clear phrases you can use. I have a fishy odor and thin discharge. Can we test for bacterial vaginosis and also rule out thrush and sexually transmitted infections, if appropriate? This keeps recurring. Can we talk about a plan, not just another prescription? I am pregnant or trying to conceive. What is the safest and most effective approach? What symptoms would mean this could be something more serious, like pelvic inflammatory disease? And if you feel embarrassed, remember that clinicians see bacterial vaginosis every day. Shame is the least useful part of this conversation. Bacterial vaginosis is common, treatable, and nothing to be ashamed of. If you have been suffering in silence, avoiding intimacy, or feeling unclean, I want you to hear this clearly. Bacterial vaginosis is a medical imbalance. It is not a reflection of your worth. Get clarity, get treated, and if it keeps coming back, ask for a plan. You deserve comfort and confidence in your body. A really helpful next step is understanding what different discharge colors and textures can mean. When you know what is within the normal range for you, it becomes much easier to spot changes early and know when it's time to get checked. Tap the thumbnail on your screen now for our video on vaginal discharge colors and what they can mean.